phase is really exciting for physicians. It is a time of big transitions, and it is a time, most importantly, when physicians are seeking board certification and starting an independent practice, transitioning from training to having their own patient panels and making decisions truly independently without oversight. For physicians who are starting in private practice, in addition to taking care of patients, they may be learning about how private practice operates and the responsibilities associated with that. For those starting out in academic medicine, may be learning about how they function within an academic medical center and the responsibilities associated with being a faculty member. And the specific responsibilities and incentives may vary across the many other settings in which physicians start their careers.
This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated.